September is National Thyroid Cancer Awareness Month, and here to discuss the symptoms and treatments in this sponsored interview is Dr. Jason Hunt. He is with U of U Health. And Doctor, here we are the last week of the month, so a good time to still talk about awareness when it comes to thyroid cancer.
Yeah, thanks for having us. Thanks for the opportunity to really talk about thyroid cancer and making people more aware. It's a disease that probably most of us know someone that's either been affected by it or themselves may have been affected by it.
So what is thyroid cancer, so our viewers know? Give us the basics.
Yeah, so the thyroid gland is a gland that sits in the lower portion of the neck, kind of here in the front. It produces hormones that are the motor for the body. Just like other tissues, though, you can develop abnormal cells or cancerous cells in the thyroid gland.
I guess that's the question. Why is the thyroid so important in our body?
Right. Without a thyroid, again, it's like the motor for your body. So if you don't have a thyroid in place, you feel sluggish, tired, and it can even have effects on other systems of the body, like the heart.
All right, what are signs and symptoms to look for of thyroid cancer?
Yeah, most thyroid cancers are actually found without a lot of symptoms, meaning they're found with just a lump or a swelling in the neck. So the patient otherwise, or the person may otherwise be feeling fine. In advanced cases, you may have other symptoms. Where it's located, it sits near the voice box. You could have changes in your voice, or it could affect your swallowing. But by and large, most people, they find it just because someone notices. They look and go, oh, you've got a lump on your neck. You
and I were talking at the break about the reality TV star that a viewer actually noticed. And did they call in, email into the show and said you should have that checked? And could that have saved his life?
Yeah, it could. And that happens actually not infrequently. People will notice. I mean, sometimes it's not always that dramatic where it's a TV personality that someone calls in. But oftentimes people will say, yeah, did you ever notice that you have this swelling in the neck? And they're saying, no, because a lot of times they don't have the symptoms. And only in advanced cases would you have, pain, discomfort.
Is it genetic? If someone in your family has had thyroid cancer, are your odds more likely?
Yeah, there is some genetic components, and there's some diseases that are pretty rare. So those rare diseases, most of the time because you've had multiple family members that have had thyroid cancer. And we've done some work at the Huntsman Cancer Institute looking at the genetics. And if you have a family member that's had it, you're a little bit increased risk, but it's very, very small.
Interesting. All right, treatment options. And when it comes to this, is there hope?
Yeah, the nice thing is that most thyroid cancers that are found at an early stage in treatment, which involves surgery almost always, but most of these can be cured with surgery and with some other adjuvant treatments as well.
So you can go in and remove it?
Mm-hmm. Yeah, we surgically remove the thyroid gland. A lot of times we have great medications that can replace the hormones that the thyroid gland produces.
All right, so risk factors for everyone out there to be aware of.
Yeah, most people don't have risk factors.
Okay.
Most people just will show up with a lump in the neck. However, there are some risk factors. If you've been exposed to radiation, which, for most of us, we haven't been exposed for significant amounts of radiation, but that is a risk factor. Family history is a little bit of a risk factor as well.
You mentioned that, like a little bit of a risk factor.
A little bit for most of the thyroid
You point at your
cancers.
neck, but just so our viewers know, show us the most common spot on the neck that you see that lump.
Yeah, it's actually, if you know where the collarbone is, it's right above the collarbone, kind of in that lower portion of the neck right here.
And how big would the lump be, doctor?
It could be pea size to bigger. But most of the time, you wouldn't notice it until it got to maybe, a half an inch to an inch in size.
Interesting. So if you recognize something like that and you have questions, what would you do?
Talk to your physician, number one. And then ask for an evaluation. Oftentimes, that would start with just an examination. And if they confirm also that there's a lump in the neck, and they may order an ultrasound to further evaluate the thyroid gland.
All right, Dr. Jason Hunt, everybody, joining us this morning to talk about this. If you have questions, there is a website on the bottom of your screen, healthcare.utah.edu, that you can go to for more. And our thanks to U of U Health for sponsoring this important interview. Thank you so much.
Thank you for having me.